Today, we want to talk about rhinoplasty. First of all, you want to know that am I a good candidate for rhinoplasty? How many years ago, uh, patients did rhinoplasty as reconstructive surgery. But now, there are so many techniques we can do for almost any nose. We consider rhinoplasty if you have not natural appearing nose to make you more natural. What should you do before surgery? Beside physical examination that your physician will do in first visit, in some patients we consider a CT scan of the nose and paranasal sinuses. In every patient with a breathing problem, and also in every patient who had a past history of trauma to the nose, we consider CT scan of the nose and paranasal sinuses. In every nose job, we consider general anesthesia. But in some patients who have little work on the nose, for example, only rasping of the hump, it will be done with sedation or local anesthesia. About scars on your nose in nose job, in closed rhinoplasty, there is no scar on the nose, on the skin of your nose. But in open rhinoplasty, there would be a small incision on the columella. If your ala of the nose are in lateral position, then your surgeon will make small incision inside of the ala to put the ala in the right position. We usually do not use incision on the lateral of your ala. As you know, the structure of the nose is amazing. Parts of your nose are skin, soft tissue, cartilages, and also bone. In rhinoplasty, we shape cartilages of your nose to get final results. We usually do not remove or change the shape of your soft tissue of your nose. We do not remove skin of your nose, but we change the position of your bone of the nose. In almost all of the rhinoplasty cases, we use absorbable sutures on the columella and inside of your nose. We use external splint for shaping of your dorsum of the nose. After the operation and after about 5 to 7 days, we will remove external splint from your 2 third of the top of your nose. For about 2 days after the operation, use cold compression for reduction of the swelling of your face. For about 2 to 7 days, your head should be up about 30 degrees to reduction of the swelling. Avoid straining, for example, heavy activity for about 3 weeks. Be careful about direct trauma to your nose for about 6 weeks, and avoid sunglasses wearing for about 6 weeks. After the surgery, you must irrigate your nose with saline or a nasal spray of saline as much as it is possible for you. For analgesia, use only acetaminophen. Do not use aspirin or NSAIDs, which will cause increase of the bleeding from your nose. In almost all cases, there is no need to stay one night in a hospital or clinic. It is better for you to be in Iran for about 7 days after the surgery. Please apply tape on your nose for about 30 days. Swelling will reduce in 2 or 3 months, but for final results, you must be patient for about 1 year. Nose job costs include clinic anesthesia, and surgeon cost is about $1,000, and you must pay 30% more if you want to do this in hospital.